What is a bunion? A curious question, isn't it? A bunion, in all its bumpy glory, is a bony protrusion that forms on the joint at the base of your big toe. This occurs when your big toe starts to lean towards your other toes, leading to a shift in the shape of the nearby joint. Now, this might have you wondering, what does a bunion feel like? The telltale signs are not too elusive. A bunion manifests as a bony bump on the big toe joint. This bump can often lead to discomfort and pain, particularly when walking or wearing shoes. But how can you be sure it's a bunion? Well, a diagnosis typically involves your healthcare provider learning about your symptoms and examining your foot. If your symptoms are severe or surgery seems likely, an X-ray might be ordered to check for potential joint damage. Now, if you're grappling with a bunion, there are a few things you can do to alleviate the discomfort. Start by focusing on your footwear. Shoes with plenty of room, particularly around the toes, can make a significant difference. Stretching exercises can also help improve joint mobility. A bunion pad, a small cushion, can prevent your bunion from rubbing against your shoe. And don't forget the power of ice. Applied for 20 to 30 minutes after exercise or when in pain, it can bring some relief. Over-the-counter pain relievers can also be beneficial. But what if these self-care measures aren't enough? If the pain persists or worsens, a foot specialist, known as a podiatrist, may be able to help. They can provide you with special shoe inserts or orthotics to help align and support your foot during the day. A foot splint worn at night can also help straighten your toe and possibly slow the progression of the bunion. For those with severe pain or difficulty walking, surgery might be an option. There are several types of procedures that can help realign the toe and reduce the bumpy appearance of a bunion. Is prevention possible? Unfortunately, no. But if you already have a bunion, you can prevent it from worsening by avoiding shoes that put pressure on your toes. In essence, a bunion is a bony bump on your big toe joint. It causes pain and discomfort, especially when wearing shoes or walking. Diagnosis is usually through a physical examination, and an X-ray may be required for severe cases. Treatments range from self-care measures like comfortable shoes and ice packs to medical interventions like orthotics, splints, and in some cases, surgery. Prevention might not be possible, but it's important to avoid shoes that squeeze or put pressure on your toes to prevent a bunion from getting worse.